Hello and welcome, or welcome back to the COVID Advocacy Exchange. I'm Dave Fuehrer with Grit. Today's conversation is our 7th episode in this COVID Advocacy Exchange series. Our conversation and all of our discussion today will be focused on practical solutions for patients during COVID. I was just taking a moment to center myself before this conversation. And I almost, to be honest with you, can't process both how significant this moment is, but how truly remarkable these individuals and the work that they're doing to help patients in this moment truly is. We can't talk about survival if we're not talking about the person who is surviving. This conversation that we're about to have brings together individuals who are expert in industry, in advocacy, and in humanity. Some of them are individuals who helped me find my voice over the last 8 years as an advocate. Some of them inspire me every day with the writing and the work that they do. Others are people that I've met in preparing for this session, and to hear the passion and the drive and the purpose that motivates them during this challenging time is truly humbling to be a part of. We hope that you take an active part in this conversation. Our work is not complete without your voice. We hope you'll use the chat function at the bottom of the screen to provide comments or questions or thoughts at any time during this conversation. In fact, why don't we start that way right now? If I could ask everybody to please use your chat function and type in, where are you? Where in the world are you connecting with us from? I'll give you just a moment to do that. Thank you. I'll get to read where everybody is after my comments. These individuals and our moderator, whom you're about to meet, are doing truly remarkable work that we all help support you, help support us, and help support advocacy during this time with COVID. But it is also their humanity and their personal stories that I believe will move you. These panelists and the work that they do, the resources they're about to share, and this conversation have been developed specifically from feedback we've heard over these last several months. We hope that it addresses the comments and things you've shared with us. And if you're new to this advocacy exchange, we want to know what you're dealing with, and we want to hear your voice. We together, advocacy, industry, patients, are not complete without everyone's voice. Our mission with Grit Health is to help people find their voice and to use their voice. We are deeply honored by the partnership and support from Bristol Myers Squibb to be able to create this COVID advocacy exchange and their belief in survival and in humanity. And we are deeply honored and grateful for our partnership with Evoke Kind to help elevate our voices and awareness for all of the work that everyone is doing. I'm very honored to introduce in just a moment our moderator, Gaetano Crupi. Gaetano is the General Manager and President for Bristol Myers Squibb in Brazil. In our prep session, he shared that his mission is to help ensure access for patients in his country who might not otherwise have access to treatment. That to him is personally not okay. But it is his personal story that I hope he will share with you. His humanity and his character and the reason he is so fueled by this work is why I am so truly humbled to be a part of this conversation. Each of our panelists will share that, the work that they're doing and the reason they are who they are. In Gaetano's words, everything we do is for someone's life. We're honored to have you here with us, and I am deeply honored to introduce our moderator for the conversation, Gaetano. Please welcome him with us.
Thank you, David. Thanks for the inspirational opening remarks that you just shared with us. So, yes, I am Gaetano Crupi. I am the general manager for Bristol Myers Squibb in Brazil, based in São Paulo. For the participants, and I can see here that I should say good morning, good afternoon, and good evening, because we are all around the world. And again, in few words, I think you summarized very well why I wake up in the morning every day, among everything I have ahead of me during the day, making sure that patients have access to the drugs we develop. It is my #1 priority. I'm going to share more about it as we go through the discussions, but as we have great panelists here and we want to hear from them, I am going to get started. They're going to introduce themselves, and then we're going to go around and share what we are doing. Okay. So I think the first person that I would like to ask to introduce herself is Kelly. And Kelly, please make sure you share with us some of the good news you also got it just before we start this session. And we are all thrilled and happy for you. So Kelly.
Good morning. My name is Kelly Brassil. I'm an oncology nurse by background, which is how I first met Dave through my work with adolescents and young adults with cancer. I now work as the Director of Medical Affairs at PAC Health, which is an organization that supports individuals with chronic conditions through digital health coaching. And I'm just so pleased to be here with all of you today. And I appreciate the shout out to the news that was just shared. I didn't actually have a chance to read through the whole notification, so it may be embargoed. So I will just say, just get some really wonderful news about work that I've been doing in the nursing community and being recognized for that, and just so grateful to be able to be here with all of you today and continue our work, especially with our advocates and all those who are working hard to support individuals during this pandemic.
Thank you, Kelly. So, Megan.
Hi, everyone. I am Megan Claire Chase, but many of you know me on social media as Warrior Megsy. I am a breast cancer warrior, published cancer writer, blogger, young adult cancer influencer, and cancer advocate. And also, tomorrow is my birthday. Yay! But I am really thrilled to be here today with this impressive panel to talk about some practical solutions that I have as a patient, as a warrior, and just as a human during these crazy times. Thank you.
Well, Megan, congratulations and thank you. Pat, would you go next?
Hi, good morning. I'm Pat Masterson. I'm from Milwaukee, Wisconsin. I work for a company called Husco International, where I'm on the leadership team. We're a global electro-hydraulics and controls company for automotive, construction, and off-highway. You might think that I'm on the wrong Zoom call right now, but I'll tell you a little bit about our story here in a few minutes. My background is product development and manufacturing, but about 3 months ago, I shifted my focus to a new organization that we started called Mask Force. And this is a consortium of healthcare, first responders, industry, and academic partners here in Southeast Wisconsin. And that's about 25 different organizations that came together and tried to support the local community in the shortage of PPE, personal protective equipment, specifically around masks. It's a zero profit initiative that we're working on right now, and I'll get into more details in a minute.
Thank you, Pat. Diane, would you go next?
Sure. So good morning, good afternoon, good evening, everybody. I'm coming to you from just north of New York City, and I'm happy to be part of this esteemed panel. So I am the National Director for Advocacy and Programs for the Lupus Research Alliance, and many of you here may have never heard of lupus, but COVID-19 sure put it on the map when hydroxychloroquine, which is a treatment for lupus, really became in the news a lot, and so it really was an extra hard time for folks with lupus. But the Lupus Research Alliance, we are the largest private funder for lupus research around the globe, really looking for better treatments and a cure for lupus, and hopefully in doing so, because it is we consider it a prototypical autoimmune disease, it will also help crack the code of some other autoimmune diseases. So my work really is to do advocacy work on Capitol Hill in Washington, D.C., and to help bring the voice of the patient forward. And I think we're really in an unprecedented time where there is that opportunity, especially in drug development and working with the Food and Drug Administration. So I'll be happy to share some of the initiatives that we have going on. Thank you.
Thank you, Diane. And also, it's a great pleasure that I have another colleague here from Bristol Myers. So, Anders, would you introduce yourself?
Yes, certainly. I want to introduce myself. My name is Anders Telbuk, and I'm working out of Copenhagen in Bristol Myers Squibb. And my mission is also really to make our medicines available to as many patients as possible. I think in Denmark we have a very well organized healthcare system, so very much it's about calibrating our efforts, where I think maybe there are sort of bigger structural challenges in Brazil, I'm sure. But definitely, you know, in the work with making medicines available and treatments available to patients, when I, in the process of that, get to talk to patients, get to understand patient stories, etc., that is really a fuel that is making me even more passionate in my discussions with different stakeholders, politicians, etc., when we see restrictions or anything like that being set up. So I'm so happy to be with you here today.
Thank you, Anders. I think we have over 60 advocacy organizations participating, but I would allow myself to give a special welcome to at least 4 Brazilian ones that I'm following here. I think they are all represented here, but welcome to Instituto Oncoguia. I hope Luciana Holtz is here with us. Instituto Lado a Lado pela Vida with Marlene Oliveira also participating. The IMF, the International Myeloma Foundation, com Cristiane Battistini, que deve estar, she should be there as well, and Abrali through Miruga Stiegel. So welcome, a special welcome to my Brazilian fellows. As we go through this, I would like to share some of the things that I really am involved. When you look at a country like Brazil, it's a continental country. I mean, it's like the United States, 27 states. I mean, it's huge. And unfortunately, the contrast is what makes Brazil, Brazil. We have 200 million people, and roughly 1/3 of those 200 million are able to get private healthcare. So as soon as you have a new product coming, a new therapy, if they have private health care, and if the product is given in a hospital or in a clinic, they will have reimbursement. The rest of the country will depend on the public system. And a new therapy, like the ones we are talking today, can take up to 10 years for getting into the public listing. And that's, for me, is not acceptable. So the quest that I have as head of Bristol Myers is, how can we reduce that time to be ideally equal to if you are in the private healthcare? And also, if by any chance the new medication is an oral medication, that oral medication is not also automatically paid by the private healthcare. You need to go through another submission, and makes life very hard for all patients, okay? And personally, I have seen those differences. My mother lives in Italy. My mother is a head and neck cancer survivor. And when she was diagnosed, through knowledge, through connections, she had the access to the surgery and treatment, may be faster than what would be the average. But the question is why that is not available for everybody, because that can be the difference between life and death. That can be the difference of patients suffering. And so we should be doing everything in our abilities and in everything we do to do that. And that's why I feel honored to be part of that group. And I have a niece in Sao Paulo, and she has lupus. And I remember when the family called and then say, you know, we're having problems to have access to this new drug. And how can we do and find that work? And then when you have somebody close to you go into the loops of those difficulties, you can put yourself in their shoes and say, what can I do to help? So I just would like to do this introduction in terms of what motivates me, what we're doing, where we put our resources, and hear from you in each one of your areas of expertise, whatever you're doing. How can we make patients' life better? How can we help them to have better access? They can have the best treatment that is available for them. So with that, I would like to maybe ask for Megan to start. I mean, and Megan, tell us, you know, everything you do. I mean, I know that we would take the whole afternoon for that, but if you can summarize in 10 minutes, that would be great. And then we go around, and I will be looking into questions that may come in, and we can then address those. Okay? Thank you very much. I mean, Megan.
Thank you. So a little bit of my story is I was diagnosed with stage 2A invasive lobular breast cancer in September of 2015. I was diagnosed 2 months after my 39th birthday, so it was really strange to literally be a cancer, the irony, right? So I've had 16 rounds of chemo, 8 surgeries, 33 radiation treatments with a lot of long-term side effects and permanent damage. With that, I am infertile, medically induced into menopause well before my time, because my body is intolerant of all of the post-treatment medications for my type of cancer and my pathology. So, you know, I have chemo-induced fibromyalgia, permanent neuropathy in my hands and feet. You know, I also have 2 benign lesions on my spine. What? And the biggest kicker is I was laid off from my job as a marketing project manager in March due to COVID. So my employer insurance, we all know how crazy insurance is here, especially in the US, it was ripped away from me 2 days before my scheduled 6-month scans. And I nearly, you know, flipped out. It was a lot of stress, an intense stress to be able to get those rescheduled, and it was really hard to get those rescheduled. But I was able to the day before my coverage ended. That's a problem, to be that scared, to not know if you're going to still be NED, no evidence of disease, because you're losing your insurance. Very crazy time. And so on top of worrying about, you know, will I get a new job with the good insurance before my next scans in October, I also deal with chronic pain from back issues and fibromyalgia and costochondritis, which is inflammation of the cartilage in my rib cage. I mean, would you guess all that looking at me? I look pretty darn healthy, don't I? You know, looks can be deceiving, the invisible illnesses. And I think for many of us who are cancer warriors and chronic illness warriors, we consistently carry an additional stress and anxiety on a daily basis, which is even more heightened because we are in the midst of a pandemic with no vaccine. So I'm taking this time to pursue and research avenues where I can become a full-time cancer writer, advocate, and speaker. And, you know, going through cancer has made me realize I can no longer just exist in the world. I need to live with purpose and do what I can to affect positive change. So since I am single, I do go to the store sometimes to get the things I need and medications. You know, there are just some things I need to buy and touch and feel. But each time I see a person without a mask, I literally feel a tightness in my chest. For the first time ever, I'm starting to have anxiety attacks. And I often want to scream to these people, without a mask that I'm one of those immunocompromised people. Why don't you care about my life? I think because many of us in this space have had to and continue to face our own mortality, that we remain hyper vigilant and protecting ourselves. I know during my chemo days, I began to incorporate many practical ways to minimize germs. I just continued those practices because they became second nature to me. I mean, sometimes I do get a little OCD about sanitizing, but if it gives me peace of mind, then hey, I'm gonna keep doing it. But who else feels like they're in a continuous loop in the twilight zone? You know, this is nuts. So not only has my anxiety increased, but I'm dealing with the ups and downs of depression too, due to COVID. I miss going out and people watching. I miss going to a coffee shop with friends or on my own and writing. I miss the fun interactions I would often have while waiting in line with someone, because I'm a talker, I'm always talking. I miss going to the ballet and theater. I miss being hugged. It can be so easy to feel like we're disappearing sometimes. I knew I was in danger of going down the rabbit hole, so I made the conscious decision to get on the Zoom train and remain engaged with friends from all over the world, like you here today. So during this forced pause, I've been able to engage with friends on a deeper level through weekly group activities from a lot of the cancer support groups and one-on-one Zooms. Yes, I'm utterly fatigued some days. Don't let this mascara and gorgeous face fool you. But maintaining those interactions is necessary for my mental health. I'm one of those cancer warriors who wants to know about other types of cancers and chronic illnesses, because we all know how the body can change after a cancer diagnosis, especially because many of us have developed autoimmune diseases stemming from our harsh treatments. So I'm taking this forced pause to rest, even though a bit stressed, engage with old and new friends worldwide, and to go back to some of the things and activities that always brought me comfort and didn't have time to do on a consistent basis. So these are scary times, and I'm just glad that I'm still on this planet and feel wrapped in support with you.
Megan, thank you so much for sharing. I hope now that you have spoken, you have the time to read the message you received. And thanking you for sharing and really calling you no less than a hero and everything you have done. So very encouraging. I mean, I hope you take the time to do it. You mentioned something that it has been very interesting. I know that Luciana Holtz is on the call, but Instituto Oncologia in Brazil, they just had a survey. And what they have found during this COVID, that close to 43% of cancer patients that are ongoing treatments right now could not do their treatments. Some numbers, 40% because of the hospital has canceled. Around 12% they own have canceled. They were scared to go to the clinics, to the hospitals, and only 3% was an agreement between physician and patient. So I think with that in mind, it would be also interesting to see how can we help patients, because stopping treatment for those cancer patients on ongoing treatment because of COVID can be really harmful. With that, I would like to ask Anders to share some of the things they are doing in Denmark, and then that can be a helpful way also to help those patients.
Yes, thanks a lot. Well, actually, it's a very simple story and solution, but maybe I can give you a little bit of background. So, I mean, the healthcare system in Denmark is extremely organized, I would have to say, and we have been working closely with the melanoma community as a company over the years, both as goes for the diagnosis of patients and also the treatment of patients. the thing is, in Denmark, if you have been diagnosed with melanoma, malignant melanoma, and have undergone surgery and as such removed the bad tissue, so to speak, of the melanoma and clinically are healthy, what happens then is that you are called by the university hospital to attend what they call a patient school, or what we call a patient school here in Denmark at the university hospitals. And at that patient school, basically patients and their relatives are being taught in what to be sensitive to when you have undergone surgery. If there is reoccurrence of a birthmark, how to look at that, how to protect yourself, the relative to look at the melanoma patient's back, etc. All of these things work in an extremely organized way, and all of you that know of melanoma would understand, and that definitely having that ability and sensitivity to reoccurrence of disease is very, very important. Now, in the context of COVID-19, as in the rest of the world, at least here in Denmark, what happened was that I mean, only the most critical people were allowed to attend the hospital. So clinically healthy people that had undergone surgery, they couldn't go to the hospital. They couldn't go to attend this patient school at all. The relatives couldn't go either. So we and my team back in May actually sat with the management of the oncology department at one of the biggest university hospitals, and we're looking at the number of patients basically piling up. They had around 250 patients who hadn't attended this very, very important patient school, and we were basically discussing how on earth could we cater for a solution to provide this important education to relatives and patients. And we came up with the idea to do an educational session externally out in the open. My teammate basically said, why not do a drive-in bio, a drive-in cinema? In the middle of the city, there is a huge parking lot that is not being used for anything at all. We could set up the tech stuff and do a drive-in bio for patients, and gather all of those patients that haven't been attending the patient school for 3 months. So in very practical terms, what we did was to call the municipality, secure that we had access to the area in the middle of the city, and arranged for the event to basically happen in June. So all of that was basically arranged in a very short period of time, and I was there myself, and I know it's probably, I don't know if it's, I mean, for me it was a very, very special moment, because you can understand when you work in a large company, there is a lot of processing. Very often you sit behind your computer, right? But I'm being passionate about working in the company I do, because at the end of the day, we help all of you patients, right? And I was sitting there at this drive-in bio, one of the first guys parking, and the cars just arrived one by one, and we ended up having 250 to 300 patients coming in one go. So that was an amazing moment for me, and also fuel on the engine to think creatively on how we can convey important information in an effective way to patients going forward. A little bit about the concept. So basically, on stage, we had a full projection of 4 or 5 people. So a surgeon, a nurse, an oncologist, patients, and the whole multidisciplinary team, as we call it, around effective treatment of a melanoma patient. And they were basically, it was like a talk show, open air, with the whole thing being fully projected live. And you know, we were sitting there and it was a warm summer day, and still we had all of these patients coming. So sometimes it takes just you know, a meeting and a great idea and some energy, and you can put forth something which is very different but also very effective. And eventually, I mean, we have national television, multiple TV stations coming and covering the event because people thought it was an amazing way to do things differently. And our plans right now is to try and expand the concept, so to speak, to other important areas of disease in these times where relatives still are not allowed to enter the hospitals. Only critically ill patients are still in Denmark. So I think that was sort of the short description of what I would consider an idea that suddenly grew very big and got a lot of attention. But most importantly, we reached these 300 patients in 2 hours, and they got super important information on precautions to take in order to avoid a reoccurrence of their disease. I think I will pause here and ask if there are any questions to our initiative. And again, I feel very honored to be able to share it with you. I think, I mean, when I was asked, I said, I mean, it's a very simple thing, right? But it seems to have made a difference to a lot of people. So I'm very thankful and very proud of that on behalf of the whole team here in Denmark.
Anders, thank you very much. I have one question for you, which this morning internally at Bristol Myers, we had a newsletter. I saw some pictures of the cars coming, so very, very exciting. But the question, which is one that I have also, even though we cut by bureaucracy a lot, the question is how did you do to pull this together so fast? I mean, that was the secret. So we have that question for you.
Yeah. Well, the whole process thing around, you know, on the back of the scene, so to speak, from a Bristol Myers perspective, maybe we can discuss that offline. But I think, you know, everybody around the table just thought it was an amazing idea, and the need was immense, right? The backlog of patients not having received this information was so distinct and so clear to everyone, and I mean, the way we worked around it was that, I mean, we did the whole idea generation, etc., with the team at the hospital, and then we extended a sponsorship to basically secure for the technical equipment and moderators, etc. But I can tell you, I mean, even from a financial perspective, I can be very transparent around that. I think the whole thing cost around $6,000, which, you know, taking into consideration that 300 people and their relatives were listening in. I think that was a very cost-effective kind of arrangement, still considering that normally the hospital are bringing in all of the patients in smaller groups and spending a lot of time on that. But I think, I mean, bottom line, it was a great idea. The innovative angle seemed appealing to all of the, should I say, stakeholders in the system, and hence built a passion to accelerate the solution and all of the practical stuff around it. Does that provide an answer?
Yeah, I think so. During this time, I think all of us are receiving quotes and people saying things here and there, but there's one quote that I heard which was very interesting, is innovation and humanity always have two things in common: sense of urgency and a common enemy. So, and I think that's where we're going through. I mean, we need to resolve things as quick as possible, and we have one common enemy, which is you know, the COVID. I had one other question in terms of was there a shortage of production of chemotherapy around this time? What I can share with you is there was supply issues, not necessarily because the production, but because people build up inventories. So there was, I think right now, almost 6 months since the first case, things are getting to normal. But in the first quarter, there was a peak of inventory, which is natural. I mean, people were afraid of not having access to their drugs, and that has been normalized. The other issue is certain drugs that are manufactured mainly in China and India, because of the production, they had a bottleneck in that situation. In the case of Bristol Myers specifically, because we control our manufacturing chain, we depend on ourselves. We were able to really provide that supply without any issue, but we are just controlling, make sure that we don't leave too much in one customer in order to jeopardize for the another one. Okay, but thank you very much. Another quote that I heard during this time, which was made me think a lot, and I will pass the microphone to Diane, is somebody saying, we are all humans. We live in one place, and that place is called Earth. And we all together are under the same storm, but we are not in the same boat. And I think realizing that not everybody is going through the same thing, I wonder if Diane can tell us what she is observing and facing with the patients with lupus, and what are the things that she's doing about it, and how can we be even more helpful. Thank you, Diane, if you can share it.
Yeah, thank you, Gaetano. And to build off what you were saying and what Megan Claire was saying, lupus is one of those conditions that's kind of like an invisible illness. And, for people who are immunocompromised, constantly living in a world where just shaking hands can be dangerous, especially like, in flu season. And so these kinds of precautions that people take on a regular basis, that a lot of their own support systems, family, friends, colleagues, just don't understand some of these cautions. So we were trying to really tell people's stories, because we really felt like people with lupus and other chronic illness had a lot to teach the rest of us about how we could cope with this pandemic, and help maybe get their friends and family and support networks to really understand what they go through on a regular basis. So, one woman felt very vindicated by the fact that she always carries a mask, gloves, and hand sanitizer, which now I think we all have in our bags, in our cars, in our stash. And, so it's just really, we were trying to figure out how we could help people to tell those stories. And as a research organization as well, how can we take some of the research and that understanding and help convey that to people? So, one of the things that we really tried to do was be a voice of reason in this storm, because going to the idea of drug shortage, hydroxychloroquine, I think, was one of the drugs that experienced the biggest shortage. So in addition to just being thrust into this pandemic, and for the patients trying to adjust as an organization, we were, our headquarters are in New York City, and we're all trying to, keep everything moving forward, and how do we keep our research going and our work in clinical trials, because ultimately that's how we're most going to help people. But there was so much sensationalization, I think, and not to say that what people were going through wasn't terrible, and it really was, and some of the stories about the difficulty of people getting their medications, but there was also some, I think, scary and misinformation being promulgated. So we felt it was very important and to really, calm people and help them to understand, you can go a little bit, without your medication, or here's what you can do, and here's what some studies have shown. And yes, everybody's situation is different, but really trying to sort of, help to be a voice of reason, and sending out communications and webinars, and really then sort of taking a combination of data and the personal stories. So we did conduct a survey So to understand what people experienced in the medication shortage. And we wrote up a report that combined the data and the personal stories and sent that to the FDA and to members of Congress, because we cannot let this happen again. You know, I think we really have to figure out a balance between, you know, medications that are out there and that exist that people so much depend on, and making sure then that those people can get their medication, but if it has a potential for something else that comes along, that we're not, you know, sort of taking one away from the other, and that we figure out how to balance it. And to Gaetano's point too, you know, the things that there are, you know, issues of medications coming in from, you know, India and China and those things. So maybe, you know, supply chains and things are something we'll think about, you know, a little bit more, you know, going forward. But, you know, really helping to bring people's voice forward, I think, is a lot of what we were doing. And then, you know, also speaking to a lot of, you know, what Megan, you know, was talking about as well is, you know, the additional stress and, you know, job loss and everything else that was happening to people during this time. And the last thing somebody wants to do is end up in a disease flare and have to go to the hospital. So, you know, working with other organizations and finding resources and sharing resources. We have a very close relationship, for example, with the Hospitals for Special Surgery here in New York City that has a wonderful social work team. So they really, you know, in a webinar we did with them, shared some great resources and practical tips for how to deal with those stressors. And again, you know, we always encourage, you know, that these often are for, you know, people with lupus, but really for anyone with chronic illness. And again, for any one of their care partners, their loved ones, to really help and understand what they're going through. And I, you know, really hope that we've been able to, you know, help do a lot of that and encourage that. Telemedicine, I know there was a session last week specifically on that. You know, I think that's a wave of the future. So trying to provide some resources on telemedicine and how telemedicine is really, you know, in some ways it's great because you don't have to leave your house, right? You don't have to do, you know, all that travel that puts you at risk. But how do we make sure that, you know, the doctor-patient relationship doesn't suffer and maybe potentially grows from that? And that, you know, maybe, you know, it is a way of the future, and, you know, you go in when you need blood work or x-rays or things. So, you know, I think there's tremendous opportunity at this point to really rethink healthcare. There's been so much talk about clinical trials. You know, people who may have never really heard of clinical trials before, it's hard to, you know, I think with all that's happening and hearing about all the clinical trials happening in COVID, and probably not the top thing on people's minds to participate in clinical trials. But, you know, I think a lot of what we're learning now that has been forced upon us, I'm really hoping we can turn out to be positive for all the people with lupus, all the people with chronic illness that are out there. And what's really important is for people to make their voices be heard and to speak up. And now I think is really the time. And a colleague of mine, you know, said something, and she framed it very nicely, that, you know, the convergence of the political, economic, and social dynamics have really aligned in the past few months. And we're ripe for change now. So how do we take advantage of all that? So, you know, a lot of what we did too was trying to do disease education. So we had some short videos really educating people, you know, again, like on lupus, there was so much talk about cytokine storms and you know, one of the reasons why hydroxychloroquine and some other drugs used for rheumatology and autoimmune conditions were so popular was because of these similarities. So a lot of what we were doing really was trying to help educate the public and people with lupus and helping to give them a voice and an understanding and boil down some very complicated science. And like everyone, we're pivoting to a virtual world, and, you know, how do we, you know, continue to connect, because like Megan said, you know, you want that hug, you know, you want that personal contact. I know personally, I haven't seen my best friend except for a drive-by quick conversation, you know, and it's really something that we're all struggling with. So really, we launched in May a campaign called Learn from Lupus for Lupus Awareness Month, and it's on our website. And I think, you know, we've got some terrific resources there that can help folks, whether lupus or other chronic illnesses, and how to cope with the depression, the isolation, telemedicine resources, and really how we can just sort of move forward, help raise awareness, help keep research going, and clinical trials, because really that is the wave of the future. And it just, this whole thing really exacerbated that there are so many diseases out there of unmet need. And the only way to reduce the pain and suffering from illness, you know, is going to be through medications that can help treat these illnesses and make people feel better. And so really a lot of what we're doing there and trying to help bring the patient's voice forward, and how can we you know, keep the great progress going in the medical and research field that will hopefully benefit everybody. That's some of what we've been doing.
Thank you, Diane. I tell you, it's so exciting because if you look at the chat here and all the questions and all the comments, I mean, I wish we can stay here the whole afternoon. But before I go to Pat and Kelly, that, you know, they will talk, I think Megan has received a lot of questions, and I think some solutions or suggestions for patients. Megan, would you like to answer those? Because I see here a trend, and if you can make your contribution, then we go to Pat and then Kelly.
Yes, so I have a few things that I do to try and minimize the germs. So I have a little trick. I always carry my own pen wherever I go. I have my own pen, which is sanitized. I put it in every purse because I'm a purse person. And therefore I'm never without one. And I also use that for even when I'm checking out at the store, if I don't have gloves, I use my special pen to, you know, input my PIN number or whatever. So that's a handy trick I learned from my chemo days. I also have little bottles of hand sanitizer in every purse as well to carry. So that way I'm never without my hand sanitizer. I also wipe down my keys. How many people think to wipe down the buttons on your keychain, right? I do that like once a week. I also Lysol my front door, the handles, both on the inside and the outside, and the locks. And then I also wipe down my remote. I do, you know, because you're touching that a lot, right? And of course, wiping down my cell phone, because you always have that to your face, and you could have been out somewhere and you're still touching it. Like as soon as I get home, when I'm come in from the store, I immediately wash my hands for actually longer, a little bit longer than that 20 seconds. So I sing a little song. But that's the first thing I do before I touch anything else, is as soon as I come back inside, I wash my hands. And then I'm always remembering to stay hydrated as well during this time, because when you're not really able to go outdoors and you're just kind of stuck at home, you sometimes can actually forget to drink water. Like you're just sitting there for a while chatting with friends, you're like, wait, I'm thirsty. So little things like that. And I also, when I go into the grocery store, I have a list, and I have to remind myself to bring that list. So I have Post-it notes on my door before I go out to say, don't forget your list, you know, because you always forget when you go out. But I keep that list, so if I have to go to the store, I go in and I come out, you know, so I'm not in there any longer than I have to be. And so those are some of the little tricks that I have for myself. Hope that helps.
Thank you. I tell you, my list is well shorter than that, but it will change after this call. I guarantee you. Thank you very much. Pat, would you share? I mean,
Sure. Morning, everyone. Before I begin, I'd like to say a big thank you to our entire consortium, our team on our project, and my family. a lot of which are on the call today from around the country. Without you, we would not be here where we are right now to support our mission. So let me tell you a little bit about our project. I mentioned it before. It's called Mask Force. And I'll ask you guys at the end to check out our website, maskforce1.com, for more information. So our project started actually on March 23rd, and I remember it because it started right here on my street in Milwaukee, Wisconsin. And one of our neighbors is an ICU doc at a local hospital called Fuehrer Hospital. And Dr. Paul Burgle was going door to door in our neighborhood collecting masks, because if you remember, the big news at the end of March and through April was the shortage of personal protective equipment at our hospitals. And for those of you that are in the healthcare industry, you've been dealing with this for 3 or 4 months as we go through the challenging health crisis that we're in, and you know exactly what it feels like to be vulnerable in your place of work. I didn't think that was okay. Paul did not think that was okay. And we pulled together a team. My teammate, Austin from Husco, we said, you know what, we can find a better way. We can find a way to help solve this problem. The company we work for is a manufacturing company. We design and build custom products and solutions for our customers, the big 3 automotive, construction equipment companies around the world. We've solved a lot of hard problems for many years. Not to mention our leadership team and the family, the Ramirez family that owns Husco, they are focused on serving the community. And so we saw this as an opportunity to bring a skill set together, a sense of urgency, like you mentioned earlier, and a way to serve others. And so we did that by pulling together a consortium. And so that included a number of healthcare workers, first responders, there were fire departments, EMTs on our team, and a number of industry participants outside of the healthcare industry. So these are industrial companies that you've probably never heard of before because they're not in the medical space, but we all came together and said, you know, we can help, and let's find a way to do that. And what we came to find was there were a number of teams in Southeast Wisconsin that were already working on this problem. Kyle and the team at University of Wisconsin-Milwaukee, Dr. Dan Sem at Concordia University, were already out ahead of us working on 3D printed masks as a potential solution. And so we decided, instead of trying to solve these problems individually, we said, okay, what would happen if we invited as many friends and colleagues and industry partners together? And what it turned into was a pretty amazing group, over 25 organizations. We had daily conference calls. And 5 days in, we had 50 people on the call calling in from multiple states. We were pulling in people from really all over the country to lend a hand. And so that was what was really interesting about our project. And so from day one, we said this is a zero profit effort. And our goal was to design a professionally producible, large-scale mask, a reusable face mask with a disposable filter that could be used by frontline healthcare workers. And so that started really as a community effort, and it's turned into something quite a bit bigger. So the consortium members included attorneys, biomedical engineers, nurses, doctors, people that were providing input in a lot of areas of expertise that were outside of Husco's expertise. And that's what really made this thing work. And everyone came to it with the goal of just helping others. And so I think that's kind of our constant theme that we're going to hear today, as well as in this advocacy set of calls that are coming up in the future, is how do we help others during this time? I'm humbled to be part of this project. And what was impressive was an around-the-clock effort for over a month. People putting in 12, 16-hour days through weekends, knowing that we had to solve the problem as soon as possible. And so we went from basically a discussion and a clean sheet of paper to production in 40 days. It's a product development cycle I've never seen before, and it's continuing, and that's what's pretty interesting. So let me take you through just a couple of notes on our project, and I'll show you the mask here in a second. So the voice of the customer from our healthcare professionals and from our firefighters and local first responders. They wanted something that was safe and breathable, and they wanted filtration. They wanted something that could be reused, and the filtration could be thrown away, so disposed of after a use. And if you think about the close contact situation that a lot of our healthcare professionals are in, they want to make sure that they're safe at all times during the day. And so that was kind of number one for us. We wanted it to be sterilizable and to be able to be used in a lot of disinfecting protocols that each of the organizations had. We wanted it to be soft, to be wearable. We wanted it to fit a lot of different face shapes. And this has proven to be one of the biggest challenges. Everyone has a unique face. Everyone has different features. And so trying to design one or two products that can cover all the different face shapes has proven challenging, but fun at the same time. And we think we've made a lot of progress on our product. We also wanted it to be low profile and sit close to the face. And the goal for that was for healthcare professionals to be able to wear a face shield while they're wearing our mask. So not only is it protecting their airway and protecting them from others, but it will also fit underneath that face shield. And that's really an important protective device that a lot of people have turned to. Okay, so it's made of medical grade materials. I'm going to hold it up here for a second. This is my show and tell. So it's got 6 components. It's made of 6 different components. One is a silicone seal that is removable. That's an FDA grade medical silicone. A hard shell. And this was a request by our first responders. It was something that they wanted to be rugged and durable, that they could take on calls. And the most important element, and I think this is where a lot of folks on the call will find this interesting, it's a quick release filter cartridge. And so basically the filter comes right out, and you can dispose of the filter element. You can wipe it down with antiseptic wipe, put it back together, and you're ready to go. There's an adjustable strap that fits on the base of the neck and up on the back of the head. And I personally probably have the most time in the mask. I've been wearing it in our factory and actually out in public. It's kind of interesting to go out in public when you go into the grocery store and you look like this. But it's a great performing product, and we've gotten a lot of really good feedback on it. Let's see, a couple other notes on the product. Well, we'll get to the notes here in a second. So the product, and so one of your questions might be, okay, so you're a company in manufacturing, but what experience do you have, and what is the product certified for? And so we work closely with our legal team and some former FDA folks, and we worked pretty closely with NIOSH as well. And so although the product is not FDA cleared or approved, there is something called the Emergency Use Act. And the Emergency Use Act has allowed manufacturers to produce products during this pandemic that we're in right now. And as long as you abide by the safety requirements and product labeling requirements and produce the test results, that's how we have moved forward with the product. So the EUA is still in place here in the United States. And it will, and we believe that it will protect folks that are wearing it based on our filter testing and a lot of other testing that we've done with local first responders. So just a quick update on the project. So we went to production at the beginning of May, and to date we have shipped 17,000 masks, and that is mostly to healthcare systems, nursing homes, first responders. We are starting to get a lot of interest actually from industry as well. for folks that are going back to work, factory, food and beverage, industrial. They want to make sure that their employees are safe. And so this has become a nice option for a number of different folks. We do get a lot of personal requests as well, and I'll talk about that here in a minute. So we're in the middle of our initial production run. We committed to 30,000 masks at zero profit. And what's been great is our supply chain, the component suppliers, people that helped us with the design, donated manufacturing equipment, donated tooling. They have allowed us to price this at a very competitive price. So it's a $15 mask. And that we believe is really important to make sure that we're offering it to many that otherwise wouldn't be able to get this level of product. We are also developing a second design. We have a smaller mask for smaller faces. We found that one size fits most, but it doesn't cover everyone. So we're in process with that. We have a goal to ramp up production here later in the summer. We are pursuing N95 certification. So that might be one question from a lot of medical folks is, have you worked with NIOSH? And the answer is yes, and we're pursuing that. We don't have an exact date, but we are working through that process, doing a lot of testing of the product, and our goal is to get N95 certification in addition to what we would call kind of a consumer level mask as well. All right, so those are kind of the project updates. What I do want to close with, though, is my personal why on this project. And so, you know, the initiation of the project was really to help my friends. So I have friends that are firefighters and doctors. But besides that mission, I have a personal mission and a personal thank you that I have to call out. And I think some of the doctors from the hospital are on the call today. My wife, Sarah, has a rare autoimmune system disease. It's called GPA, formerly called Wegener's. And the local hospital system, the Medical College of Wisconsin and Frederick Hospital have cared for her for the last 14 years. And so this is also my personal thank you to them working on this project and being able to supply this mask. So for those of you that do have compromised immune system, we understand. We understand that as a family, and we understand our personal 3-month quarantine that our family has been under. And so I really understand. I understand where you're coming from. I understand the kind of the feelings and emotions that go along with that as well. I thought last week's Advocacy Zoom call that was hosted covered a really important topic around mental health. And that is something that I think can be easily forgotten when you watch the news or you only talk about statistics. But we are all human beings, right? And the Mask Force and our team, we each have our own personal why. And I just explained what mine is. And everybody is motivated and driven by kind of their own. So I'm going to leave you with a challenge to think about. I think now is really the time to come together. How do we find things that that are in common between us, right? And I think now is a time to think about gratitude and think about serving others. I just heard that statement recently is, why don't we take this time to serve others? And I think that's the theme of today's call. So with that, I'll say thanks and open it up to questions.
Pat, thank you very much for sharing this amazing story. I have one question. I think you did answer, but I want to make sure that the person that asked the questions, how people with immune compromised diseases can have access to the mask as an individual.
Yeah, that's a great question. So I'm going to ask if you are interested in learning more about the product, go to our website, maskforce1.com. And there's a way to contact us in there. And what we have done is we've really focused this initial production on the first responders and the healthcare organizations that are interested in the product. But in addition, we have partnered with a local nonprofit. It's called Bridge to Cures. And Bridge to Cures is distributing the mask for us in smaller quantities. So our focus has been on some of the larger orders for some of these organizations, but Dr. Dan Sem at Concordia University and the team at Bridge to Cures is providing masks in smaller quantities. And so he's actually doing it for free. And what he asked for is a small donation. And so if people are interested, they can contact us through the website, and then we can connect them with Bridge to Cures.
Thank you. Thank a lot for this inspiring story. I just want to comment on the working together. The development of vaccines and drugs that are going on with the companies, folks on R&D, also has an unprecedented work together. Multinational companies combining their scientists. I mean, in the case of a Bristol Myers Squibb, we are not working on vaccines, but we released 2,000 items on our library of chemical entities that are being tested to see if they have any action. So I have been in this industry for a long time, but I never saw a partnership work as we are going through at this point in time. So Kelly, last but not least, please, if you share the wonderful things that I'm sure that you also are doing with this audience, I really appreciate it. Go ahead, Kelly.
Of course, and I know that we're close to time, so I'll provide an abridged version. I think that what we're hearing from all of our panelists today, and for those of you who are on the call who have experienced a chronic condition, you know that there isn't a pause button for cancer. There isn't a pause button for lupus. It's not like the body's like, oh, we're going to focus on COVID right now, and so I'm going to give you some reprieve from these other experiences. So really, I think what we're trying to achieve is a recognition that while the healthcare community may be shifting its attention to COVID, rightly so, and trying to figure out solutions, we're also seeing the repercussions of that for individuals with diagnosed and maybe yet to be diagnosed conditions. You may have seen Gaetano's post in the chat where he noted that there's an anticipated 50,000 undiagnosed cancer cases that have been predicted to have occurred in Brazil during this time. We know that this is happening worldwide. So we know that there are individuals with current conditions who may not be able to access care. There was one participant today who noted that their surgery for their breast cancer, newly diagnosed breast cancer, was delayed several months. And then we also know that there are people yet to come who may have conditions that are going to be diagnosed and will need support. The other thing that we know is that the data tells us that individuals with chronic conditions are most vulnerable to the most significant side effects of COVID-19. And so therefore you're coping with the fact that you're already trying to manage a chronic condition, that you're at higher risk for significant complications if you contract COVID, and that can have both physical and psychological repercussions, which is so critical. We heard the mention, Pat, you just made a comment about the importance of mental health. And that is an important component, not only for individuals with pre-existing conditions, but also for those who are first responders, who are coping with quarantine at home, and who are dealing with all of the different financial repercussions of layoffs or uncertainty of work and finances. So what we are doing as a company at PAC Health is really coalescing a product that we already had, which was digital health coaching. We were already supporting individuals with one or more of over 25 chronic conditions and providing human-to-human support, as well as digitally enabled coaching services. And I think the importance of that, and I heard Megan say it, is that you take for granted how important it is to talk to a human being. We've become an extremely technology dependent world. Some areas or individuals having more access to those resources than others. But at the end of the day, nothing replaces the capacity to talk to another human person. And so the work we do really focuses on connecting individuals with a team of certified health advisors who complement the work that's being done by your medical team, but also provide support for you as a whole person. We go beyond just the condition. We do have evidence-based condition-specific coaching tracks that focus on things like autoimmune, respiratory, cancer, cardiometabolic, but we also go beyond just the specifics of a condition to support the whole person, the mental health, the financial toxicity of treatment. And we are very fortunate to have been the recipient of funding that will allow us to provide free 3-month coaching to up to 2,000 individuals with any type of need, whether you have a diagnosed chronic condition, you're a first responder, you have a caregiver who's working to support you who may have additional needs. We heard Pat mention the support that you've provided to your wife, and there are implications for caregivers who are supporting individuals with chronic conditions as well. Our goal is to provide small goals that are achievable in the context of COVID that help to support overall wellness, that progress health and health behaviors, especially as we're having to adapt creatively when many of us are still contained in our homes. And I see Lauren's posted the link to our site. We're also, I believe, have information in the lobby, so anyone who wishes to learn more can. But as a healthcare provider, I just would say to all of you on the call, whether you're an individual who is managing a chronic condition, you're the caregiver for an individual, you're an advocate, or you're a person in industry or healthcare providing support. You heard Gaetano say so beautifully, we're all under the same storm cloud right now, but the resources and the personal experience of that storm is so unique to each person. So please do connect with the individuals on the call today, whether it's to receive a mask from Pat's wonderful initiative or to attend a drive-in educational opportunity like Anders talked about, or to leverage the resources that organizations like Diane's are providing to individuals with specific conditions. And I think Dave is also going to speak to this, but the outpouring of comments to Megan was so profound. I was following your comments as Megan spoke, and the importance of connecting with other people who have a shared experience of an illness and a shared experience during this time can really help to provide some reassurance, what's normal, what's not. I believe Dave's going to talk about Vivabot and how we can use resources that Grit Health is already readily providing, but do connect, whether it's through Grit or other organizations, to hear the voices of those who have kind of gone before you. And we find that that often provides some reassurance. And I want to just say thank you to all of you who are out there coping together, alone together, through this COVID experience. It's an honor to serve you as a company, certainly through PAC, but also to experience this alongside you as a member of a community. And then as Megan mentioned, together wearing our masks, supporting and taking the precautions we need to support healthy communities and lives.
Thank you, Kelly. And before I pass the word to David, usually it's always happened this way. You are invited to come and participate or maybe to give something to someone, but at the end, you are the one receiving it. So I am, touched by the comments for everything you do, for listening to your stories. I am going to open up here. There is one question that I want to make sure we answer. Can we use the links provided out on social media groups? David, can you answer that? I think yes, but I don't want to guess. Yeah, I'll let you respond specifically to that one. Any panelists would like to make any additional comments before I pass to David? As we went through, I have a million things that I would like to touch, but unfortunately we do not have the time. Thank you very much for the opportunity. Thank you very much for sharing. Diane, go ahead, Diane.
So I just threw into the chat, I think one thing that we often forget about is dental health. Mental health is super important, and so is dental health, because so much bacteria or germs can get into the body through gums. So I know a lot of people are wary of going to the dentist as dentist office reopen. So just don't forget that your dental health is also very important to help stave off germs and illness, especially if you're already compromised. So thanks again, everyone. This was wonderful.
Thank you. So with that, thank you very much for all of you for your contributions, and I'll turn to you, David, for the closing remarks. A lot of people are saying, can we stay longer? But you are the one that, are you going to answer that? So thank you very much. I really appreciate it. Thank you. And David, it's with you now. Thank you.
Thank you. And before I let Gaetano, you and the panelists go, may I ask, with how much of yourself you're pouring into this, Gaetano, what was it like for you to lead this panel and to connect with all these individuals and see all the comments, and what has this experience been like?
Extremely grateful. I was really concerned to come in first. I said, well, what am I going to say? I mean, and you know, and then we had a chat before that. But at the end of the day, I focused on what my mother is going through, and what she's going through now. And she had to do a new biopsy, and I keep thinking on the people that are close to me, and when Pat talks about gratitude, is I know that I can do so much, and I think this whole situation just raised the human that we have inside of us. I mean, if you don't think with your heart and with your mind, then what are we here for? I have seen some of the sessions, and again, I think this is the time that we are. When you look around, that this is not a problem of one country or one nation. It's all of us. And if we don't do something together, who will? And again, I think it was a great opportunity. I thank you very much for allowing me to be part of this. I feel honored to be here. Thank you.
Thank you. I was so moved by your comments in preparing this panel, and I can speak for me personally, and I'm going to come back to the panelists, so please don't anybody leave yet. But you know, I can share personally that when we started creating this COVID advocacy exchange about 3 months ago, the very first thing that we did was listen to all the advocates, ask them what this was like and what they were going through and what kind of support they needed. And I have to be honest how heartbreaking it was to hear not only the organizational ways people are being affected, but the very personal ones. And so to sit through these conversations and all the work and elevating health and humanity that everybody's doing, I didn't know that we'd get to this place 3 months ago. So Gaetano, just so grateful you brought out the humanity in the conversation so much. And I'd love to ask our panelists, and if I could start with Megan Clare, I have to admit I follow you on social media, and your posts make me cry more than I might want to admit, in ways that almost like pull back the curtain, you know, what it's like to be a patient going through all these things. What's it like for you, Megan, you know, creating all those and then, you know, getting to share and connect with people around your voice?
Well, thank you, Dave. Those are really kind words. You know, it's important for me to be authentic because I have to remind myself I'm not alone. And if I'm going through something, then maybe someone else, maybe one or two people might see it. And that's how I kind of approach anything that I write, is maybe this just might help one other person and then they might share it, and so on and so forth. But it's also helped me gauge my mental health. And there are just so many things that we go through as a patient, so many feelings, emotions, you know, the anger, the frustration, but also the gratitude, the hope. It's so much. And I think it's important that everything is talked about, you know, because yes, we can be positive all we want all the time, but we also need to be real and feel those feelings and push through it. So to know that others are getting some hope or feeling like their voice is heard and that I can maybe help be their voice or help them find their voice has just been the ultimate gift for me. And I'm truly humbled and honored that I'm able to engage with so many people worldwide, because at the end of the day, it's our life and we are important.
And for anybody that wants to go read your stuff or follow you on social, where should we point them?
You can go to warriormegsy.com, or you can type in your search bar Life on the Cancer Train. And I am on Twitter and Instagram as @warriormegsy, and hope to see you there. Feel free to reach out anytime.
I love it. I love it. Said with such authenticity, Megan, and I'll see you there, and I hope others do too. May I use that to jump right back to Kelly? And Kelly, this program, I know you've gone through all the steps of applying for funding and working on building something to help patients. And Megan Claire just spoke so beautifully about, everything we're going through. These things are not individual issues. They're all interconnected. And so Kelly, what's it been like for you, starting, going to get funding, creating this program, now seeing patients going through it, and what could they expect, or how can they connect with you and be a part of it?
Sure. Our CEO, Mazi Rasulnia, had commented that it felt like our purpose as a company was really defined. It was a tipping point for us when COVID occurred, because we already were connecting. We've connected with over 18,000 individuals with chronic conditions to date. But the digital delivery of that is really fine-tuned for this time. I think the most important thing that we try to keep in mind is that we're building an experience and a support for individuals with the individual in mind. All the nuances that come with one or potentially more chronic conditions, perhaps a diagnosis along with mental health needs, and that we're here to support that. And so I think it's been an honor to be able to come to the table with a ready-made solution that allows, for example, anyone who's on this call today can just simply go to the link and you're there and you're in and you're signed up. So it's wonderful to be able to support the solution, but we also know that the work is far from done, and that the implications of this are going to extend far beyond this acute phase into an endemic post or during the continuation of COVID and then beyond. So we are happy to be at the table now and partnering with all of you, but we also recognize that we have to commit for the long haul to support the many needs that we may not yet know about as people cope with COVID and recovery.
That's amazing. And we're going to send, so there's almost 1,000 people registered for this COVID Advocacy Exchange. We're going to include in the post-session email information about that, both Megan for your contact information, Kelly for that program, and Pat and Anders and Diane, in just 2 minutes if we could. Pat, I think we'd like to announce that everybody who's been live with us today on this session will receive at no cost one of your masks, and we're working on a donation to be able to take care of that for everybody. So we'll ask for people's emails and get their mailing addresses, but so excited to be able to share your work with everyone.
Yeah,
what is it?
Thanks,
yeah,
Dave.
Yeah, no, honored to. Please, sorry.
Yeah, so we'll make sure that everyone on the call today gets one of our Mask Force masks, and I guess just support us. Drop us a note every once in a while if you have questions. It's a big challenge, and our team is up to it, and we continue to get amazing support from the community. And I think I'll just reiterate what I said before, and that's what can you do to serve somebody else today? And I think our team and the company I work for, we get up every day and we think about that. And I've been really inspired by the other panelists today, and knowing that each one of you are thinking about others and figuring out how we can all get through this together. It's been really inspiring for me. So thanks for having me today.
Thank you, Pat, so much. And Diane and then Anders, I know, Diane, you have a booth that everybody can go check out. And in the last few minutes, I'm going to give everyone a tour so they can see how to get there. But what's this been like for you to create these resources and connect?
So, well, I just want to start out by saying also, my mom has cancer. She was diagnosed about 4 or 5 years ago, and in around August, she was all clear and her port came out. And in January, it went back in for more chemo, and she's in Florida. So also, I guess, to some degree, I'm somewhat of a care partner or a caregiver. So, I always have that in the back of my mind as well. And I just also wanted to say about the masks, I love that they're, eco-friendly. So Pat and I were typing in the chat, like I only have cloth masks. So I think that that's another great selling point. So thank you so much for that. As an organization, we're primarily a research organization. So really, as Lupus Research Alliance, we think very strongly about, the fact that we are an alliance. And we're delighted to have met so many of you through this process so that we can help share the resources that are good for our community. Because I think what's really important here is that we're not over duplicating services, and that really there's so many similarities across different disease states that we can really help share, like coping mechanisms or coping mechanisms. So like in our Learn from Lupus session with social workers, you know, it's really helpful for anybody. So I'm just really grateful to be able to help share, you know, resources so that we can all work together and collaborate. And, you know, let's turn this into a wonderful positive. Let's not forget the tragedy that it was, but let's, you know, move forward and make the world a better place for all of us, especially those who are ill.
Beautifully said, Diane. Thank you. Anders, what's it been like for you?
I have to say it has been great to listen into all of the stories, extremely inspirational. And also for me, I mean, thank you for all the kind notes. I think I started out saying that I consider this a very simple idea. And just one thing on that, at least in sort of the community in which I operate here in Denmark, right? Sometimes we have a tendency to work a little bit in silos. Some are responsible for providing education, some are responsible for providing medicines, and et cetera, et cetera. But I think one thing that COVID-19 gave us was this sense of urgency and the need to pull together and co-create and come up with great ideas together. And I think, I mean, we really need to think of that and bring that with us onwards. And that's my learning. That's what I would want to promote, and all of the ideas that I've been listening to today, I'm bringing those with me, and I'll share them with as many people as I can.
I can feel your energy and your purpose, Anders. Absolutely. It's been such an honor to have this conversation. I'm going to spend our last few minutes together giving everybody a tour of what this virtual conference looks like and ways to connect. And just one I wanted to mention for our GRIT resources before I do, we have a support tool on our GRIT website, and she's called Vivabot. And Vivabot is a 28-day positive psychology program. It's a chatbot, and for anybody who's not familiar with or hasn't met with a counselor, you know, live or one-to-one, or just wants to see what support is like, Vivabot is a wonderful way to start looking for support, especially as we're all going through such real mental health and practical challenges. So I encourage everyone to please visit grithealth.com. Grit is with a Y, and Vivabot was created for young adults with cancer, but she's really wonderful at talking to everybody. Just a quick, it does a quick 10-minute check-in each day, and actually helps reduce anxiety by doing this check-in and increase resilience, which is something that we all need right now. And then I'm going to do a screen share, and really excited to share with everyone this COVID Advocacy Exchange virtual conference. So here we are on the main landing page, which is covidadvocacyexchange.com. And if this is your first time visiting, you can register here. It's just a couple of quick questions. Once you're registered, all you need is an email address, and it takes you right in. So no password, it's a single click. And you go automatically into the auditorium where all of our sessions are. We're actually live right now. So you see this join button. For all of the pre-recorded sessions, there's a play button. So you can go back. I think Kelly or Diane mentioned the telemedicine session we had recently. You can go back and see Safely Returned to Clinical Trials. All 7 of the ones we've completed are here, and we've got 3 more live ones that are coming up that we're really excited for everyone to visit. And then also in here is this virtual exhibit hall, and you can see all the booths that everyone has set up. So Bristol Myers Squibb has resources. You can just scroll down and see all the documents, the videos, links to helpful resources here. It's all interactive and clickable. And then if you zoom out, you can scroll along the side here, and there's more than 25, I think almost 30 booths in here. I know Pack Health has a booth. You can check out them and their resources. Lupus Alliance, Research Alliance has a booth. Please visit them and check them out. And as we get into August, we're going to do more of a focus on these exhibitor areas and connecting people to resources. And then of course you can journey around and see the lobby area. There's an information area for questions. It's meant to be a really interactive place for you to see all these resources and view everything that's in there. So as we creep up on the end of this session, I don't want it to end. I was sitting here listening to the conversations with my eyes closed and just feeling everyone's purpose and caring and compassion. And I have to say, just in addition to how much I've learned, I really felt like we're a part of something that is bigger than ourselves. And I see everybody's head nodding on our panel. And I hope everyone, wherever you're connecting from, you feel connected. You feel like you're a part of this advocacy exchange. We would love to hear more. So please complete the follow-up email questions that we send. Share your thoughts. Contact us, and we'd love to get you involved in this exchange. And with my heartfelt thanks to Bristol Myers Squibb, to Evoke Kine, all of our panelists, and you, everyone in the audience. Thank you for being with us. Cheers.